Greetings and welcome to this first edition of Fireside Chats with the Baptist Health Foundation, sponsored by the foundation here in Greater Louisville. My name is Justin Liechty and I'm the Executive Director of the foundation, and it's a joy to welcome you this evening to what is our first, but we trust will not be our last, Fireside Chat. The global pandemic has changed so much of the way we work and live, and that is certainly true of our work here in the hospital. Health organizations have become impacted like almost no other part of society. We've deeply missed the friends and volunteers who've made up the auxiliary, the warm faces that greeted people in the hallways at the hospital. And so tonight's event is a little way of opening the door to Baptist to invite friends in to hear and see from leaders in the healthcare industry about what's happening inside the hospitals. We are eager to see our friends come back, and we want you to have a window into the workings of what we're doing to fight the pandemic and COVID-19. This event tonight and all future Fireside Chats are open to anyone. This is a public event. We would love to have as many people come as are interested in coming. We simply ask that you let us know you're coming by sharing your email address with us. A special thanks to the foundation team, to Alyssa and Steph and Janie and Brett for your work tonight in making this happen. And for tonight's speaker, he really needs no introduction. Our president, the president of Baptist Health Louisville, Larry Gray. Larry joined the Baptist family, I think it was 38 years ago. Is that right, Larry?
Close, yeah. Actually, it would be, yes, 38 years this September.
So almost 38 years ago, working in Lexington, he was president of Baptist Health Corbin for many years, and then in 2018 was asked to come to Baptist Health Louisville. He is an adjunct faculty member of UK's MHA program. He's been on their faculty since 2002, and in 2016 he won the Distinguished Alumnus of the Year award at their Martin School of Public Policy and Administration. Larry has spent tireless hours over the last year helping serve our community. We are all very grateful to him, and he joins us tonight to speak about our vaccination efforts here at Baptist Health Louisville. My last note before we let Larry talk is we're taking questions tonight. So if you have questions, please feel free to put them in the chat bar. We're collecting those, Alyssa and I are, and we'll have time after Larry speaks to address them. Mr. President.
Right. Thank you, Justin. Can you hear me okay? Never assume on Zoom. Okay, thank you. So what I'd like to do tonight is spend about 15 minutes or so with some presentation updates of where we are in the vaccination program, and then give you a chance if you've had questions that you want answered, then you can put those in chat. I will not reach beyond my ability to answer questions that are outside of my league clinically, because I am not clinical. But if there's an important question that you have that you need an answer for, again, by putting in the chat and putting your name to it, we will do some research or get some answers to you as you might need that. So my goal tonight is to just for us to be in a relaxed setting, join around the fire, and share some information with you and updates about where we are. So I am going to share my screen, and I want to show you just how inept I am. No, I will show you. Can you see my screen? You see the chart? Good. This is a chart that we get every morning that some of our folks have put together, and so this is my update I see every morning about where we are with our vaccination program at Baptist Health Louisville. As you may or may not know, at Baptist Health Louisville, we're receiving the Pfizer vaccine, which is a 2-dose vaccine 4 weeks apart. So I will try to make this a little larger so you can see some of this. Up in this corner, you'll see that right now, as of yesterday, we have at Baptist Health Louisville, we have vaccinated, we have put in people's arms 32,243 vaccines. And 20,550 of those have been first doses. And we have been able to follow up with 12,292 second doses. So that is where we are today at Baptist Health Louisville. For Baptist Health System, to date, we have vaccinated 146 people. 100, let me add them. 146,000 people have been vaccinated in Baptist Health across the state of Kentucky. Now, what's important about this chart is, let me show you some other information on here that is important for you, perhaps. Right here is today's date, and we walked in today with 537 people scheduled on our drive-through vaccination clinic. Out of those, if you drop down here to this chart, out of those today, 194 were second doses and 343 were first doses scheduled. If you drop down to the next area, you'll notice that out of those, 61 were through our ticketing process, and 252 came through our webpage, and 224 all others, including some of our internal messaging, and still getting people signed up through our internal messaging as healthcare workers, office practice personnel, and a variety of other things. So we look at that every day and try to track that. Now, the reason, do you know what the ticketing process is? When we first opened up online, there was no way for us to create a filtering process. We asked people in the community. We said, this is where we are. We are, for example, we are in 1B, and these are the people that in that category that qualify to sign up for a vaccination at Baptist Health Louisville. At that time, everybody in the city was in 1B in terms of vaccination. And so online, the registration process included an attestation where people said, I meet the criteria, I meet the age criteria, I'm this old, and signed up for a vaccination. Believe it or not, people are not always truthful in those attestations. And so we found ourselves vaccinating people who did not meet that qualification, but we had been assured by the state that our primary goal is to get vaccination in people's arms. And if somebody shows up and they don't quite meet the qualifications for whatever reason, obviously we cannot waste a vaccine. We need to go ahead and put it in the arm and vaccinate the person. So what we then discovered with further work as a system around our Epic and MyChart is that we can actually push out messages now. And we've created the process to do this, and that's the ticketing scheduling process, where we can send out messages on MyChart to target audiences and say, if you respond to this and if you call this number, we'll be able to schedule you for a vaccination. We had really hoped by this time we would see that number growing more so, and we are seeing it grow some. That's right in here. This is up through, this is today. Tomorrow, 49 people have signed up through MyChart. We really want to see that grow because that gives us some control. On the other hand, and I'll share some information with you in a minute, within about 3 weeks, that will not be an issue anyway, because the state is projecting that within about 3 weeks, we will probably be wide open in terms of the vaccination process. So does that make some sense? We've tried to create a way for folks to get vaccinations. There has been no perfect way of doing it. We have not had, through our EPIC program, not had the ability to create long waiting lists. And I know some other, I think Norton's, for example, has a waiting list, but that waiting list is people scheduled all the way out through like June. And that is a long time to wait. And so we have not gone the route of that kind of a long-term waiting list. We do keep a waiting list of people who met criteria and for whatever reason have not been able to get in, and that when we have people who are no-shows, we are able to give them a call and say, if you can get here in the next 20 minutes, we'll get you your vaccine, and you'll be guaranteed your follow-up second vaccine. And I want to show you that one point. This box right here are canceled appointments. The other issue that we have faced, and I think we have resolved pretty well by just keeping on top of it and rescheduling folks, is that people have gone out and scheduled themselves on multiple sites around the state, and whoever they get into first, they go and don't take time to call us back and say, hey, I've already got my vaccine, I need to cancel my appointment so you can get somebody else in. So we do have no shows. We have cancellations, which is a good thing because we can track those, but we also have no shows. People just don't show up and tell us about it. And that's when we really need to use that short wait list in order to get folks into the clinic to get a vaccination. Okay, now I'm going to walk quickly through some of this so that now can you see that it says vaccine chat? Okay, current experiences in the United States, 40% of people over 65 have been fully vaccinated. That means they've received both shots of either the Pfizer or the Moderna. Just now starting to roll out the J&J, which is a single shot. But 40% of people over 65 have been fully vaccinated. 30%, however, have not even had the first dose. Now, this is again the first this is that special category of people, perhaps even with comorbidities and so forth, but people over 65 years of age. 21% of the total population has been vaccinated, and that's it. And so when people talk about, reaching herd immunity and being able to return to normal, only 21% of the total population in the United States has been vaccinated, as of a report from the federal government just a couple of days ago. 100 million people may have some form of immunity, short-lived immunity, because they've had a previous infection of COVID. What we know right now is that it is likely, what we've seen is a degradation of the immunity starting within a few months, and 90 days out, often there's not a trace of antibodies from having been ill. So the antibodies from experiencing an illness with COVID is not a long-term solution. In other words, you can be reinfected. You are not protected. 6 months from now, you're not protected from what we understand right now. This is the distribution across the world. And this is not raw numbers, raw population. This is percentage of people who've been vaccinated. And again, you'll notice United States is in third place in terms of percentage of folks. When I said about herd immunity, early on, they were saying, 60 to 70% of people vaccinated, we would have some form of herd immunity. Now, again, we in the United States and in our markets in Kentucky, we are using Pfizer and Moderna primarily. The Pfizer, these are what's referred to as mRNA vaccinations or vaccines, which means that they basically create a non-infectious piece of the coronavirus spike protein when activated by the vaccination or by the vaccine. And the body responds by making antibodies that then protect the body from absorbing or from being infected by the COVID virus. So they do not contain, I heard just on the news yesterday, I was watching some people who said they would never get vaccinated because they've had the flu vaccine and got the flu, and which, that there is no live flu virus in the flu shot. But nevertheless, people, that is a part of the lore out there, and people are afraid that there is a coronavirus, pieces of the coronavirus in the Pfizer Moderna vaccine, and they might get sick from that. They might get COVID from the vaccine, and that's just not possible. That is not an mRNA, messenger RNA vaccination, does not contain any of the virus in the vaccine itself. And so that's just reality. And then the same thing for the adenovirus vaccine, which is the J&J single dose. And basically, it's just a vehicle for delivering instructions to our cells about how to fight the virus if you come up against it. And so it starts creating antibodies and protecting the body against that. Now, obviously, you're hearing today that AstraZeneca is before the FDA might get approved. There's a lot of questions about that. It's been approved and used in other countries. It's been pulled from other countries, then put back in place. So there will be a lot of questions coming out about that. Now, here's some questions. I'll cede the question time. What phase are we in Kentucky? We are in the 50 and above, and then all the other categories that we've seen earlier: educators, clergy, first responders, all those folks we're still taking care of and still vaccinating. And people are fully expecting that in the state of Kentucky, in fact, in some areas of the state that got a higher percentage of vaccine allocated by their, compared to their population, are already into that, well into 50 and above, and actually starting into 40 and above. Dr. Stack at the state believes that we will be ready to start the 40 and above in the state of Kentucky, across the entire state of Kentucky, within the next week or so. So when I said earlier that some of our tracking and worry about are people telling us the truth and signing up appropriately, may not matter, because by the middle of April to the end of April, we will probably be wide open with anybody 16 and above that needs a vaccination can get on the schedule and get vaccinated. However, I do want to say that it is concerning that we move quickly into those areas if we have not done good work in reaching into underserved populations and vulnerable populations, because I showed you the numbers a while ago in terms of the percentage of people that are currently vaccinated who are vulnerable. You start slicing that data by race and by demographics, it becomes a more startling picture. For example, right now in the state of Kentucky, only less than 4.5% of the Black population in the state of Kentucky has been vaccinated. I'm sorry, of the doses given, only less than 4.5% of those doses given have been given to Black citizens. So we know that we still have underserved, unreached populations, whether it's because of their inability to travel in rural markets, or inability to get to our vaccination clinics in the city. And one thing that we've done, that Norton has been able to set up some clinics in West Louisville in relation with some of the churches. We last week week before last, went to set up a offsite clinic in the Newburgh Community Center, vaccinated 132 people. The oldest person we vaccinated was 98 years old. We vaccinated several people who were in their 90s who had not been able to get, and these are truly vulnerable populations who, as of a week ago, still had not been able to get to a location to get a vaccination. Next weekend, we're going back to the Newburgh Clinic, and we'll be with a plan for 360 vaccinations next Saturday at the Newburgh Community Center. So all of us need to be doing a better job of reaching into underserved populations to make sure that, I would hate to think we're vaccinating a bunch of, I want everybody vaccinated, but in terms of prioritization, to be vaccinating healthy 30-year-olds when we've got a large number of very vulnerable patients and citizens. We need to do more to make sure they get vaccination. Question, can I still get infected? The answer is yes. I know all of us would like to think that's not possible. But remember, the Moderna vaccine boasts a rate of 94%, Pfizer 95+%, J&J 72%, which means you can still be in that 4 or 5% that are not protected. That's just the reality of vaccines. Yes, you can get the flu vaccination and still get the flu because it's not 100%. Secondly, what I know right now, and again, I'm not clinical, I am not a researcher, but from what I read, and probably what you read, it seems as though that even though people may get infected after completing their 2 rounds of vaccinations with Moderna and Pfizer, the experience of the illness is much less, and that really many of them are now saying we're probably close to 100% of avoiding serious illness, death, or hospitalization with the vaccinations. So, but it is not true that we cannot get infected if you've had both your vaccines. Your likelihood of getting infected is certainly from 100% likelihood down to 4 or 5% likelihood, but you're not 100%. And that's one reason why we are continuing with masking. We are continuing to say that this may go on for many, many, many months, perhaps throughout this calendar year at least, where we are still having to think about who is around us, who we're in meetings with, how we are masking, cleaning, using good hand hygiene and social distancing, all those things that we already have been practicing for the last year plus. Herd immunity, we hear a lot about that, and there was a lot of hope around this issue of herd immunity. And I would just want to be, from what I know and from what I've read, we just don't know enough at this point about either the vaccines, efficacy, or this virus, and what these variants are going to do, these new mutations and variants that are popping up around the world and in the United States. We don't know enough right now to know what herd immunity really means. The goal of the hope for any herd immunity is that enough people get vaccinated that the virus just doesn't have enough room to bounce around and reproduce and or even to mutate. And I want to remind you that with measles, herd immunity, because of the kind of virus that is, herd immunity did not occur until about 95% vaccination rate. Herd immunity for polio did not exist until we reached about 80% vaccination rate. And so, I wish I had great news to tell you and say, if we get to 60%, like some people were saying early on, that we've defeated this beast and we're back to normal. We just don't have evidence that that's true, as much as we wish it to be true. We don't know what that herd immunity might look like, or how it might be experienced, or if there is going to be such a thing with the COVID-19 virus. Now, I've thrown some things out there. Tell me, Alyssa, have there been any questions come in?
We do have one from a few of our actual hospital volunteers. They are wondering how this affects them and when they might be able to come back to the hospital.
Good question. See, Kimberly, I'm not going to ask her to answer that. But I see her here only referencing that to say that Kimberly and I had a conversation today. We are scheduling a meeting for a week from now to include some key people in terms of including the director of our volunteer program. And what we're going to do is we are going to look at every volunteer station and do some eyeballing of risk for exposure based on whether it is wide open with a lot of people coming at them at the desk, or whether they are in a department that's rather protected already with people, everybody wearing PPE or at least a mask and so forth. And we're going to try to evaluate all of those positions and see how we can start staging and when is appropriate to start staging volunteers to come in. And all of us would like that to be sooner than later. We miss our volunteers tremendously. But I do again want to be careful. We're not going to do anything just because it feels right emotionally if it is not right clinically or puts our folks at risk, undue risk. We need to avoid that. So we are actively, however, in that conversation, starting to evaluate what that would look like. And again, Lynn Kolakowski's on the line. I'm not going to put her on the spot either, but it reminds me that part of this will be an interesting thing for you to think about. Part of the issue is what are the HIPAA rules around us requiring people to tell us whether or not they have received their vaccination. I mean, we're working through some of those issues in the context of how we bring folks back on board, what we allow people to do. Again, it is not our desire to put anybody in a situation where they're at risk, but we want people back. Does that help? May not be the answer we all want right now, but that's.
Thank you.
Larry, another question that has come up that you kind of tangentially touched on is access to healthcare. This is a little bit different, but related, in that Baptist has a clinic, you said, in Newburgh. The pandemic has exposed how many people struggle with access getting to healthcare. Can you talk about what Baptist is doing to help people receive the great care that we do here in their own neighborhoods?
Yeah, well, the Newburgh clinic, when I referred to the Newburgh clinic, it was what often people are, I don't like the terminology, but referred to as a pop-up clinic. We set up clinic for vaccinations and vaccinated people. And we will be going back and doing that. We are currently working with the city and with the health department to identify other sites where we can do that in underserved populations. So we will be actively looking at that over the next couple of months while we're still doing vaccinations the way we are. And some of that depends on our ability to get enough vaccine to do that. Our goal and what the state has asked everybody to do, and right now we're getting two trays of Pfizer. That's about 2,000 doses a week of first doses. And the expectation is that we do about 90% of those within 7 days in people's arms. And that is our target. We hope that we have enough vaccine. We look at our schedule and we have enough vaccine that we can go out and do more clinics, pop-up clinics like this for vaccination. The larger question about access to care, one thing that one thing I've asked all of our service line directors to do in the next little bit is to do some more research about access issues in our town in particular, looking at the wonderfully complete health equity report that was produced in 2017. The city is currently engaged, the health equity folks are currently engaged in updating that report to a new report. And so to use that report as well as other information around the city to look at where their expertise matches up with some health equity issues or concerns. And And it may be a matter of how do we get folks in sooner? We know that, for example, um, women of color are less likely right now to develop breast cancer and yet die from breast cancer at 2.5 times the rate of their white counterparts. And so is the issue one of, as you said, of access, of getting early detection, early diagnosis, early screening. And so what do we need to be doing to get folks engaged in their own health earlier on and getting them access to good screening and diagnostics? The same thing with prostate cancer in men of color. It's the same thing with lung cancer. And we believe that a lot of that is tied to late diagnosis. And so plus there are some variations in how we experience cancer. We know from specialized medicine and the Human Genomics Project, there are differences for all of us on this screen, how we experience certain cancers and certain illnesses. We need to be doing a better job of evaluating some of this. So Justin, one of the things we're doing is asking every service line to specifically address underserved and disparities in health access and health service.
Thank you for that. We had a question from a volunteer about the current hospital visitor policy.
Yes. We are having one person designated in the hospital. Again, the reason that we are still rather restrictive on our visitation policy is for all the reasons we just mentioned about how low our vaccination rate is. Relatively speaking, we would love for everybody to be vaccinated. We're just not there. We, out of abundance of caution to protect our patients who are in-house, to have a lot of people coming in and out of the room is increasing the possibility of exposure to infection, as well as protecting our staff. So until, but again, that's an ongoing conversation. I mean, our incident command folks meet on a weekly basis. We review this data on a daily basis. So this is an ongoing conversation, as well as the conversation we have with our state. The presidents from all the hospitals also meet on a weekly basis, just specifically to discuss COVID and what's going on and when can we do what in terms of opening things up.
Thank you. We have an intimate enough group that if there are questions from the group without submitting them through the chat, you're welcome to unmute yourself and fire away. Larry, I have one question based on the 21% of people you said. So we've vaccinated about 21% of people here in the United States. Is there a sense in which, I think everyone's looming question is, when will life get back to normal? Will there ever be a normal? Again, going back to the way things were before the pandemic. Any thoughts on that? Any thoughts on time frame for when things are more like they were?
You're asking me a question I can answer in so many different ways. I can answer what I out of my hope. I can answer out of what I keep reading and what we're seeing around the country from countries that are further ahead of us. And what I mean by ahead of us, this experience started for them maybe a month or 2 months ahead of when the United States began to have this experience. And what we're seeing in those other countries does not bode well for us, that this is going to be past us anytime soon. This is Larry Gray, the person who's just one of you trying to figure this out for himself. I just don't see, I don't see us doing much differently about some things than we have been doing throughout this calendar year. Yes, we know that if everybody in the room has been vaccinated, we're certainly less at risk to be able to, if you're in a family group and everybody in the family group has been vaccinated, We had our first lunch with one of our sons and daughters-in-law that we've had for 8 months. This past weekend, we got together. They both are teachers and have been vaccinated. And we got together and everybody wore their mask until we got set at the table and we removed our mask and ate together. It was a wonderful experience. I will tell you at the same time, I cannot tell you that I went into that anxiety free. And I think that's part of whether you want to refer to it as PTSD or whatever we all are going to be dealing with as we move to whatever the other side looks like of this experience. There is a lot of work for us together, and how we, this sense of getting back to normal is, it's tough to understand what that might even look like.
Well, Larry, we advertised this would be about a 30-minute conversation. Thank you so much for sharing with us. Any final questions from the group before we close?
I really, hey, Heather, good to see you on here. I do want to say, I know some other folks have already dropped off because we said 30 minutes, but looking around, see who all's on this, you probably all know this. The foundation has set this up. We're going to keep doing this and different topics. If you have a topic to suggest, shoot an email to Alyssa or to anybody else on the team that you see here. Brett or Steph or Justin. I don't know, Jamie, how long are you going to take emails from? So, but also to know that as a part of follow-up from this, somebody from the foundation may reach out to you and with a follow-up conversation about what went well for you for this, what else we might do in the future, and also just to talk to you a little bit, perhaps even about the foundation. So thank you so much for your time tonight. Foundation team, is there anything else y'all need to say to sign off?
I think we're good. Alyssa?
That's it. Yep.
Thank you for joining us. Bring marshmallows.
Thank you all for
next time we
being
do it.
Yeah. Good.
Thanks, Larry.
Thank you.